My name is Anna LeGrand, and this is my persuasive speech. There are many reasons why people choose physician-assisted suicide, also known as PAS. People choose PAS because they have a terminal illness or they may be depressed. Many people argue that PAS is not ethical because it is a person taking another person's life, but if the person has a terminal illness, then they should be able to choose what they want to do. Many people ask, what is physician-assisted suicide? One, it's when you have a terminal illness and want to end your life earlier than what the doctor says. Or two, the action of a physician providing medication, advice, or other means to allow the patient to choose how to end their life. Physicians prescribe the medicine and they do not give it directly to the patient. Physicians are there not only to end the patient's life, but to also help them. There are many roles of what a physician does during physician-assisted suicide. First, they have to confirm the diagnosis, and if the patient is depressed, they cannot proceed with physician-assisted suicide. They have to do a bunch of testing, and then they will decide if they're able to do it or not. They have to offer comfort care, hospice care, and pain control. And if the patient doesn't have family members there, they are supposed to suggest that they contact their family to let them know what they are doing. When the prescription is filled and ready, the physician has to go pick it up, but it can only be the physician on the job. After the medicine is filled, they have to make sure that the patient wants to continue in the process of PAS. If the situation doesn't feel right to the physician, then they are allowed to stop being on that case and find a different physician to be on the case. Depending on what state you live in is if you can even consider physician-assisted suicide. Oregon is 1 out of 3 states to allow physician-assisted suicide. The patients have to be 18 or older and must be a resident of Oregon. In Oregon, the patient has to be dying within the next 6 months to consider it and also to proceed with the process. Montana also allows physician-assisted suicide. More states should consider to allow PAS so it can help people who think that it is a better option for them and will help them in the long run. There are many reasons why people are choosing physician-assisted suicide, and the biggest reason is because they have a terminal illness. And having a terminal illness with only having 6 months to live, the person should be able to choose how they want to die. 58% of people say that if physician-assisted suicide was legal in their state and they had advanced cancer, that they would choose to proceed with it. Another reason is old age, because people who are elderly, they can't do much anymore, and so they feel that they should just end their lives. Depression is another big reason, but when a patient is depressed, they can't proceed with it. They have to do a bunch of testing. Some little reasons is people may feel like a burden, like if they have a disability or they're sick, they do not want people to have to take care of them. Another small reason is because they can't control their body, and so if they can't control their body, they just feel helpless and they don't want to live anymore. People who have a terminal illness should not have to suffer. They should be able to choose what they want to do and how they want to end their lives. States should legalize physician-assisted suicide to help the people who can't help themselves and to allow them to do what they want. If the patient is depressed, they should not be able to take advantage and use physician-assisted suicide. They should have to work through their problems. States need to have strict rules if they are considering to legalize it, because then people can't overuse it and just want to end their lives when they're in a tough situation.